I commend the bill to the House.
The question is that the bill be now read the third time. Sir John Healey.
Thank you, Mr. Deputy Speaker. This government and this bill are giving health reform a bad name. It's unwanted and unnecessary. It's reckless to force through the biggest reorganisation in NHS history at the same time that finances are tight and pressures on the health service are growing. The big quality and efficiency challenges the NHS must meet and the changes the NHS must make for the future will be made harder, not easier, because of this bill. And Mr. Deputy Speaker, I want to thank my shadow ministerial team who've done such a sterling job. I want to thank also my backbench colleagues that served on not just one but two public bill committees, and all my backbench colleagues that have given such strong support to us in this House. I'd like to pay tribute to the stamina of the ministerial team, if I may, through this period, but can I say to them, we will not let up now. Because people saw huge improvements in the NHS in 13 years of Labour reform and investment. The lowest ever waiting times, the highest ever patient satisfaction. And in this, the first year of this Tory Lib Dem government, people have seen instead the NHS starting to go backwards. People have seen the Prime Minister breaking the very personal promise he gave at the election to protect the NHS. And I have to say the Prime Minister and his team, as we heard at Prime Minister's questions today, are in denial about the damage his government is doing to the NHS and the scale of criticism and opposition to it. His pause to listen was supposed to have won back public support and confidence amongst NHS staff. He's failed. The changes have been made to this bill, it's true, but these changes make the NHS plans more complex, more costly, more confused. Millions of pounds wasted on new bureaucracy which could and should be spent on patient care. And Mr. Deputy Speaker, as we in this House are asked to approve this bill at third reading tonight, the essential elements of the Tory long-term plans to see the NHS broken up as a national public service and set up as a full-scale market are still in place. First, the market. A new regulator enforcing competition law on the NHS for the first time, with the power to fine hospitals 10% of their turnover for working together. The Office of Fair Trading overseeing mergers if a hospital's turnover tops £70 million. No cap on the number of private patients treated in our NHS hospitals as NHS patients wait longer. This means, Mr. Deputy Speaker, more legal challenges from competition lawyers, more privatisation and closure of NHS services and hospitals. It means much of the planning, the collaboration, the integration, which is at the heart of the best of our NHS today, will be very much harder and may be illegal in the future. Second, the National Health Service. This bill betrays a founding principle of the NHS. For 65 years, people have known the Secretary of State and the government they elect is responsible for the definition and provision of a comprehensive health service. This bill passes that power to at least 250 local commissioning groups and stops the Secretary of State directing them as the services they must provide for patients. It makes the government unaccountable for what health services are provided and unable to guarantee patients a universal service. It's a fundamental and founding principle that our NHS is a national service, equally there for all, whoever we are, wherever we live. This bill is taking the national out of the NHS. And I said at second reading, Mr. Deputy Speaker, in January about the government's NHS plans, the more people learn, the less they like them. That was true then, and it is true now, despite the many changes to this legislation. These are the wrong reforms at the wrong time, driven by the wrong ideology. Labour, Mr. Deputy Speaker, will continue to lead the challenge against these plans in the other place, and we will oppose this bill tonight on this third reading.
The ayes to the right, 316. the noes to the left, 251. So the ayes have it, the ayes have it. Unlock.